Good morning, and thank you so much for joining us for another Talent Talk here at St. Jude Children's Research Hospital. My name's Sarah Strain. I'm a recruiter here at St. Jude, and I will be joined by two very special guests. One is having minor technical difficulties, so she'll be logging in just a few minutes. But I do have one of our very special guests here with me right now. In case you hadn't noticed, this is our special edition, social distancing edition of Talent Talks. So we are definitely maintaining 6 feet of distance between us, but hopefully we will still get some really great content. All right, Janet, I'll let you introduce yourself.
Sure. So my name is Janet Sellers. I am the program manager of our Staff Resilience Center here at St. Jude. I've been here at the hospital almost 5 years, and I'm a licensed clinical social worker.
Wonderful. Wonderful. Thank you so much.
Absolutely.
So the program that you have is called RISE. Could you kind of give me a high level overview of what that looks like?
Sure. So RISE is our peer support program, and it stands for Resilience in Stressful Events. And it's a peer support program that actually comes to us out of Johns Hopkins. We started it here at St. Jude in 2019, so last year, and it's part of our Resilience Center. Do you want me to talk a little bit about what the Resilience Center
I
kind of
would love for you
houses?
to talk about the Resilience Center. Yeah, that'd be great. Thank you.
Sure. So, as the program manager of the Resilience Center, we serve as a centralized location for staff support services. So, we recognize that doing this work and working with children with pediatric cancer or other catastrophic diseases can be hard and can be challenging and difficult at times. We want to have the right support services in place to help bolster our staff when they need a little bit of a pick me up or a little bit of help. So, that's the purpose of the Resilience Center, and RISE is our peer support program that's a part of that. We also participate in the Shorts Rounds program, which is another opportunity for staff to get together and talk about the feelings of providing compassionate care to patients and families and what that means for them personally. We also offer a lot of education in regards to burnout and risk factors and what you can do to address that. I work closely with our spiritual care services department and our chaplains, and we can offer debriefs to different areas who experience something traumatic as a unit or just want to process what has happened. And we can also provide one on one support, connecting people to different resources and needs as they need. But RISE is the program that I think we're talking more about today.
I feel like I have so many queries. I'm like, do we have 30 minutes today? So I noticed when over the RISE program that a big part of that is the peer aspect, which you touched on. What do you think? What do you think that the value is of having peers be a part of that program instead of saying like the involving peers? What is that
Absolutely,
program?
absolutely. So there is something special and unique about being able to talk to a peer. Sometimes the work that we do can overwhelm others who aren't also involved in hospital work, and they can be easily burdened or overcome with emotion because they don't walk in our shoes and they're not familiar with the things that we do. And so being able to talk to a peer in a way that is non judgmental, that is confidential, that's a safe place for you to talk about the emotions and the feelings and maybe what you just experienced on the unit. And it could be anything from a really traumatic code event or maybe someone's first code that they're a part of. It could be a near miss or a good catch with a medication. It could even just be a stressful day at work when you've been doing work that can be emotionally taxing. Just knowing that there's a peer at the hospital who can walk alongside of you, not judge you for what you did or didn't do or tell you what you need to do the next time, but to just be that supportive person to confidentially take the experience with you and help even connect you to resources if you need additional support. But what research has shown is that oftentimes being able to talk about your experience, to process that with someone, and to get it outside of your own head is really all people need in order to get back to their work with renewed vigor and excitement and be able to keep moving forward.
That's great. That's amazing.
Uh-huh.
So what do you think? It's so obviously if someone has an issue and they come to you and they're able to work through it, I would imagine that really has a ripple effect throughout the institution. So what does that look like? Have you seen any kind of ripple effect go through?
Absolutely. So I think the fact that we have 36 individuals on our
Oh,
RISE
wow.
team who have been trained to provide this kind of support to our staff members really shows that we have a culture of supporting each other through
Yeah.
difficult times. And having a team of 36 people really allows us to be spread out throughout the clinical side of our institution. And so we have these kind of embedded resilience champions
I
with
love
our
that.
rise responders. And so, as something is happening in the units, because we know that every day is full of ups and downs,
Hmm.
we have these people who are right there and can say, you know what, I think we need to take a minute and talk about this. Or, I know that you just went through this experience. How are you doing? How are you
Yeah.
handling that? How might I be able to help you? And so, I think having the large team that we have, having them spread out, having hospital leaders that really acknowledge that while we do amazing work and we often see ourselves as superheroes, there are times when we need some help too. And when we might not feel like a superhero in the moment. And so it's okay to raise your hand and say, I need a little bit of help right now. Or this has been a hard day for me, and I need someone to listen to me talk about it. And to know that we have that culture of support, that we understand that it's important to take care of yourself so you can take care of others. It really does ripple through the institution in a very good way.
That's great. That's amazing.
Hmm.
So, sidebar, since I have so many questions, I know the people that are watching this also have questions. So, if at
Sure.
any point in this conversation, I just want to let folks know, our audience know, if you guys have a question, feel free to drop it in the chat box, and we'll talk about it closer to the end of the chat. I think I was supposed to bring that up at the very beginning, but I didn't give the opportunity to yet. So if you guys have questions, drop it in the chat box. But we'll go ahead and carry on with ours. Um, so obviously, this is a very important time when it comes to resilience for a number of
Hmm.
reasons. What is one thing that you have learned about resilience in the past few months?
Oh gosh. One thing. There are so many
Sure,
things.
yeah, just
Um,
one.
let's see. One thing I've learned about resilience is I have truly been inspired and reminded by people in that we really are all inherently resilient. And I
I
think
love
what
that.
is amazing about that and what really has stuck out to me over the past several months is while we're all resilient, it's going to look different for different
Yeah.
people. And I think because we walk different paths in life and we have different experiences, that we have tools in our toolbox of things that have helped us in the past. And it's important to really recognize that and be willing to bring that out in the moment when you need it. And so I think over the past few months, I've really, again, just been inspired and encouraged and reminded that we all are resilient. We all can be
Yeah.
resilient. It's going to look different for everyone. And that's part of the reason why our Resilience Center has so many different programs, because not everyone is going to fit with the right, with the same one. We all may need a little something different depending on the circumstance or the time or the event. And so I think that that's one thing I've been reminded of.
That's great. That's great. No, I love that. I love that. I love that we all handle it in different ways.
Hmm.
And I do feel like we've all seen that manifested across campus. But it is wonderful to have those supports in place so that we're able to recognize that everybody handles it in different ways, if nothing else.
Right, right.
Um, okay, now if you could pick one thing that you have done personally to deal with the events of the past few months, or just something that you work into your daily practice to deal with stress, what would you pick?
Sure. So I love this because this is something that I've done for years. Sometimes I'm better at it than others, but I'm definitely reminded of it during this time. And it's to
Mhm.
just think of one thing each day that you're looking forward to. Now, some days you may have a huge thing that you're looking forward to.
Mhm.
And some days it may just be I really like drinking coffee out of my favorite coffee cup, and that's okay. I think what I like about this kind of idea is every day is different. They don't have to be the same, but there's got to be something in every day. For myself, it helps me be motivated, to get out of bed in the morning. Like, what's my one thing today? And it could be first thing in the morning, and then I have that thing, and I'm like, great, it's going to be a great day. This just happened. I just had that great cup of coffee. It could be something at the end of the day. And so then I can anticipate it and look forward to it
Yeah.
as my day goes on. But I think that's a real simple and easy thing you can do. Just think of one thing that
Mhm.
day that you're excited about or looking forward to.
I love that so much. I am first of all very glad that I'm not the only person that has a favorite coffee cup because I totally do. I also have a favorite stove burner though, so I'm not really
Oh.
sure that like that's really my field where I should celebrate. But that's wonderful. No, I love that, and it's so much more tangible. I do love the
Hmm.
wake up every morning and think of something you're really grateful for.
Hmm.
But the you're looking forward to is such a more tangible thing. I feel like that's wonderful advice. So along those same lines, what types of tools can you think of that our listeners today could take with them? So obviously you have tools that you work into the RISE program.
Hmm.
Is there anything that you can share with them that you think they could take out directly after our meeting today?
Sure. So, one thing we do with our RISE encounters when we meet with someone or even the responder themselves is grounding exercises,
Okay.
which sometimes, if you're not familiar with, you may think, oh, that's kind of weird and out there. But
Sure.
really, all a grounding exercise is something that can bring you to the present moment,
Mhm.
similar to mindfulness activities, which you may have heard about when you do and encounter your day and then you reflect and go, well, how did I even get from A to B? I don't remember. We just mindlessly
Yeah.
go through things. So I think that grounding exercises, anything that you can do to just take a moment and maybe take a couple deep breaths and just slow yourself down and be present. Or even if you just sit in your chair and, okay, let me notice some things around me. What am I seeing? What am I hearing? What am I feeling?
Yeah.
Just anything that you can do quickly to be present in the moment. For providers, there's even an activity, a doorknob moment. When you put your hand on a doorknob and you're about to walk into a exam room or a clinic room, just think, okay, I'm here in this moment with this patient, with this family, and I'm present. So I think that that's a easy tool anyone can do, whether you're a direct clinic provider or an office worker or something
Yeah.
far and in between. Just being present and grounded in the moments of life.
Oh, I love that so much. I'm totally going to do the doorknob thing, and I'm not a
Yeah.
clinical person, but I love that because you're exactly right. I have entire days where I wake up and I say like I have d- no idea where half that
Mm-hmm.
day went,
Mm-hmm.
um, and that's great. That's great. It reminds me of so I read this book 10% Happier, and
Yeah.
they talk a lot about grounding exercises. So this is totally off script, but can you think of any other books that you would recommend to someone that is listening today that would be good? I feel like I dig into stuff like that. Like I'm a huge nerd. Whenever I'm in a stressful situation, how do I
Yeah.
research it? Right. So can you think of any books you would recommend?
Well, I'll tell you, I'm reading right now Gretchen Rubin's The Happiness Project.
I love
Um,
Gretchen Rubin.
yes, I listen to her
Yeah.
podcast and I do all the things, but hadn't read her book. It's
Hmm.
been out for, I think it just had its 10th anniversary. So it's not a
Oh
new
wow.
book and I'm still in the process of reading it. But again, I just like the idea of, we can be happier, we can be more present, we can be more mindful, we can enjoy more of what we're doing. Certainly, when times are difficult or challenging, it might look
Mhm.
different than our happiness typically looks.
Yeah.
But what can we hold on to? What nugget is there? And how can we cultivate that and really align ourselves with that?
That's wonderful. That's great. I feel like I've had that book in my cart for a really long time. So, but I'm also a late adopter. I was totally book shamed at the bookstore recently because I bought Harry Potter and the guy was like,
Oh,
really now? I was like, don't book shame me.
that one's been
So
out for a while
10,
too.
right. 10 years is not a big deal. You're fine. Okay. So if anyone who's listening today has any questions for us, I feel like now would be a good time to drop those in the comments. I did see one pop up that said that someone someone else also has a favorite stove burner, thank you for the show of solidarity.
Oh.
I appreciate that. So yeah, so we'll go ahead and work with some questions from our audience. Um, okay, so what resources do you have in place to help and support employees who are feeling scared due to the recent unfolding of events?
Oh, sure. Um, I think that we are certainly in a time where things change quickly
Mm-hmm.
and rapidly. And I'm so thankful that we have an institution. I can't speak on behalf of our institution, but
Mm-hmm.
we're able to provide space to listen. One thing that we did when kind of the COVID-19 pandemic really
Mm-hmm.
started hitting us. And people
Yeah.
were working from home and kind of changing their normal routines. We started offering resilience rounds, which is just a
Mm-hmm.
listening opportunity for people to connect with one another, share their reflections, their experiences, and to be part of a shared community going through something.
Mm-hmm.
So currently, the Resilience Center is partnering with our diversity and inclusion department to offer some more resilience rounds, again, for listening, for hearing what
Yeah.
people are experiencing and what they're going through. And while I obviously don't speak on behalf of the institution, I'm so glad that we can listen to one another and learn from one another.
Absolutely. Absolutely. Um, perfect. Yeah, no, I feel like we can't have these conversations right now without thinking about the national climate. And I feel like the fact that
Mhm,
St. Jude has gotten, we're just such an, we're always so open to coming up with new ways to help people be their best selves.
mhm.
And I think that really plays in there. I heard that Nancy is here. Is Nancy here? Maybe not. Maybe not. Okay. Sorry, everybody. Okay.
How
Does
about
anyone
now?
else in the audience have any questions for us? Oh, I think Nancy might be here, but she might be on mute. Let's
No?
see.
Can you hear me now?
Oh, yay, it's Nancy.
Yay!
Hi.
Hi.
Perfect timing. Welcome to the
Always perfect
webinar.
timing. That's what resilience is, man. It's perfect timing when it finally happens.
Yes, no, it's perfect. It's wonderful. Thank you so much for taking time to join us today. So I'm going to rewind and we'll go ahead and let you introduce yourself.
Hi, I'm Nancy Ballinger, halfway through the program, but it's all good. I am a clinical project manager in nursing at St. Jude and new to this position in the last 3 months, but been with St. Jude for a year and a half. And in this position, I'm responsible for managing really major change projects, as well as providing additional development for clinical leaders. So those are my two-pronged responsibilities.
Great, great. And you are the head, the mastermind behind the Shine program. Could you tell us a little bit about that?
Yeah, had a lot of help with the Shine program. Need my So did you talk about what Shine stood for?
Nope, we have not. I was going to leave that for you. We haven't talked about it at all.
I was I was
We're
I was
focusing on the rise.
No problem. So SHINE is actually an acronym, and it's an acronym for um, to show up, to hone, to have intention, to navigate and engage. Because when I thought about the program, what I was really looking for is how in the world are our managers who are smack in the middle of managing up, down, and across the institution, how are they going to navigate this chaos that is coming toward us in the
Sure.
midst of the hard work that they already do for our patients and families? And so, what I came up with, you want to hear more about the program, right?
Yeah.
Okay. What I came up with was many of these managers have already been through the St. Jude Leadership Academy, which is a wonderful program for people to get exposed to the current skills for leaders, especially as it
Hmm.
relates to in healthcare. And while those programs are amazing, what happens is you get back to work and you kind of lose the focus on applying those things. So I wanted to create a program that would be kind of ongoing and provide opportunities for nurse managers to not only talk about their challenges, but then also introduce a deeper level of things like emotional intelligence and creating collaboration on your team and developing yourself. And so we made them 45-minute sessions every week. And
Hmm.
half of the session would be them kind of talking about where they were and what they were struggling with. And the other
Hmm.
would be introducing a new concept and giving them an assignment in between.
Okay,
So,
great.
yeah, different approach.
I love it. I love it. So I'm going to pose the same questions to you that I did to Janet just a few moments ago.
Sure.
In what ways have you seen, I know it's a fairly new program, have you seen or do you anticipate seeing the effects of this program ripple through the rest of the institution?
Yeah, I think I can only talk to the ripple in terms of what the managers tell me from week to week. What I've observed myself is the strength of these managers in showing up every week to deal with more and more new information and changes to process and responsibilities that they and their nurses are going to have to implement those
Mhm.
processes for patients and families, as well as other healthcare providers in the institution. Their resilience week over week is absolutely amazing. I don't even know if they can see it yet. But
Yeah.
the way that they talk about the challenges, the way that they're willing to come and just share, maybe they're frustrated, maybe they're scared, maybe they're maybe they handled something inappropriately and they want to sort out how do they clean that up.
Hmm.
But the fact that they're doing that and doing that with each other, I think the other thing I've noticed is that they're starting to provide each other guidance and support,
Yeah.
and will say, hey, if you're ever frustrated, please come to my office. We'll shut the door. We'll talk about it. We'll problem solve, and then we'll go back out and get it done. So
I love
that's
it.
some of the behavior I've seen firsthand that tells me they're becoming more and more resilient.
Great. No, that's wonderful. So these tools that you're employing in this program, is there anything that you can think of that we could share with the listeners today that they can carry with them and help them deal with the chaos that we're all in the middle of right now?
Yeah, I'll tell you what we started with. We started with emotional intelligence. And the way that I broke it down was for the first week, I had them simply observe what behavior is it that has you go to, we call it amygdala hijack, that has you go to fight, flight, or freeze.
Yeah.
And that's the only assignment I gave them. So the first thing you can do is pay attention, right, to what
Mhm.
is it that's triggering you, or what is it that is having you become super impatient or frustrated or just pop off. And
Mhm.
just write that down. And then the next week, what I want you to do is I want you to listen for what story are you telling yourself
Mhm.
about that behavior that is actually causing the amygdala hijack for you. So it's not what
Yeah.
they're doing, it's the story you tell yourself about what they're doing. It could be the tone of voice. It could be they've asked the same question for the 400th time. It just could be that they're louder than you want them to be, right? Because we're all
Mhm.
kind of getting to a frayed edge with the whole world situation. So I say you pay attention for a week and then you start to listen to the story that you're telling yourself. If you can start to listen to that story and write it down, now you've created space to be able
Mhm.
to choose a new response instead of that, amygdala hijack, impatient, yell at someone, walk away, or whatever it is that you do.
Sure. I've never done any of those things, so I wouldn't
I
know.
haven't either, but I like to help
Mm-mm.
people anyway.
I've heard other people do that. So, no, that's great advice. That's great advice. Yeah, that's definitely something that you can take with you because I feel like right now everyone is just whatever you normally feel and whatever your normal response is turned up to 11. And everybody else is also turned up to 11. So it's just kind of
Exactly.
this feedback loop that doesn't always have the best uh, results. So, no, that's wonderful advice. What about, can you think of one thing that you have used in the past few months as a personal way to deal with stress or to make sure that you're bringing your best self?
Yeah, so two things pop up for me. I'm doing more and more just physical
Hmm.
stretching and moving my body, because I find that all of that toxicity, whether it's listening to the news or whether it's supporting other people who are feeling frustrated, or Maybe I just, I really want to do something I can't do, like go to BB King's and have dinner and listen to music, and right. And that's our number one
Yes.
thing we complain about at our house, is that we can't go out and do that. Um, I'm just noticing physically that if I can move and stretch and get out of my head, then I can find a more patient space for others and myself.
Yeah, no, that's great. That's great advice. Um, Definitely, I feel you on the not being able to go. I want to I want to have a cocktail on a patio. This is my thing. That's what I'm very excited about. But no, that's great. So we have a couple of questions from our audience. I want to make sure that we have time for those. So I'm going to go ahead and bring those up, and then maybe we'll come back. Um, so Janet, you have a fan.
Okay.
One of the questions is, this seems like amazing work. Janet, how did you get your start?
Oh, sure. So,
Yeah.
I actually got my educational start with an undergraduate degree in genetics. So
Wow.
interested in science and medicine. And it was when I was working in a lab with test tubes and beakers, I thought, ooh, I need to be around people more. And so then I quick changed to social work. Um,
Mhm.
just so I could do that, work with people more. And I think one thing that I find really humbling is I've had the opportunity to work with all kinds of people. I've worked with children, I've worked with older adults, I've worked with patients in hospitals. Um, and I really am glad to have had that wide berth of experience,
Mhm.
because I think it allows me to really look at people and be willing to listen and hear what they're going through and what they're doing, and recognizing that I don't have all the answers, and none of us have all the answers, but we can
Mhm.
be empathetic supporters of one another. And I'm so
Yeah.
glad to have an institution that even has a resilient center, that recognizes that work and life can be hard, and we want to make sure that people are getting what they need, and are
Mhm.
set up for success and are taking care of themselves. So I guess that's how I got my start.
Yeah. Yeah. No, that's wonderful. And so before the state of the world became the state of the world it is now, um, I think in my head, like it was very much like a siloed thing because obviously I'm in HR, I'm not a clinical person. But I have to say, you had the most amazing metaphor whenever you gave a talk. I think it was one of our town halls, and it was the metaphor about the race. Could you share that? Because it was
Hmm.
so helpful to me.
Sure. So the St. Jude definitely has a relationship and a history with marathons. Every year, the St. Jude Marathon is a huge event for downtown Memphis and for the hospital and for fundraising efforts. And it's just wonderful. And no one wakes up one morning and says, I'm going to go run 26.2 miles. That sounds like a good idea. I don't think anyone does. I don't wake up and
No.
think that. It requires planning and pacing and really looking ahead, and even in the moment thinking, this is hard right now, but there's a goal, that I'm going for. And oftentimes, it's been said that our current situation with the COVID-19 pandemic is a marathon. And as healthcare workers and as individuals, really, oftentimes we are more of sprinters. There's a situation, there's a problem, and so we work real hard, we find a solution, and then we can move on.
Yeah.
We are problem solvers in the healthcare profession, whether we are a direct care provider or not. We like to get things done. And this is not a sprint, this is a marathon. And it's a marathon where we don't actually know where that finish line is yet. We don't know if it's going to be 26 miles or 2,600 miles, but it requires pacing. It requires us to take care of ourselves, to,
Mhm.
getting good sleep and exercise, like Nancy mentioned, and eating right, and taking breaks when we need to, so that we can continue to be in this race, and to do our best during it.
Great. Yeah, that's wonderful. Thank you. Sorry, I know that was
Sure.
um, out of the blue. I'm really glad you remembered. But no, I remember seeing that and just thinking, yes, because I did my first marathon this past year, or actually I did a
Oh,
half marathon, but it still felt very long.
congratulations.
Thank you. I was really excited. Before that, I couldn't even run a mile. So,
That's great.
but yeah, just and even as far as like, there's people lining the road that are there to like give you energy bars and drinks. And as long as we keep that kind of spirit of like, we're all in this together and eventually we're going to reach the end, I think that's so important. So important. Okay, so another question. What feedback have you guys received from the nurses? So what impact are these programs having on our nursing staff? Either one of you guys can grab that one.
So I'll say nurses, when it comes to the RISE program, I've heard over and over that it's so nice to know that the program exists. We're available 24/7. So whether you're a night shift nurse or you're driving home on the weekend or you've been at home for a couple hours already and you still need someone to talk to, it's nice to know that people are there. Many nurses, maybe who have been working for a while, talk about the days when they were upset about something and had to go cry alone in a stairwell, or how they wish that they had had this kind of support program available when they started their careers or when they went through something. In fact, many of our responders are RISE responders because they wish they had had this kind of support themselves. And so, more often than not, we hear that people are very glad to have this program available. Not sure if they'll ever need it or use it. They're glad to know
Yeah.
that it's there.
That's great.
Excellent. Excellent. How about you, Nancy? What kind of feedback have you gotten from our nurses?
Yes, the feedback I've received has come back through from the managers themselves, of course, to be able to just have the space to sort things out, and to learn and to reinforce some of the learnings that they were exposed to at the Leadership Academy. Um, and also, I've heard from their directors and from our nurse executive, Robin Mutz, that people will just some of the managers have stopped them in the hallway or had through one-on-one conversations and just said it's been so great to have that, just to have an outlet and the support of not just the support from me, but also the support from their peers. I mean, the groups are small. They're groups of 3 or 4. Highest group is 5. So they're small, intimate groups where they can really get into conversations. And we mix them up so they weren't all coming from the same area.
Sure.
So they're also getting some exposure and some support from people outside their area. So that's mostly what I've heard, in a general way.
No, that's wonderful. And I think just if nothing else, it's so indicative of the fact that these programs even exist is so indicative of how St. Jude feels towards its employees. Like
Mhm.
we value everyone. And not only do we value them, but we value what they need. So instead of just saying like, well, when you're at work, and whenever you want to cry in the stairwell, like just clock out
Yeah.
for 5 minutes, right? Like, no, we really want to give you the tools and resources
Mhm.
that you need to be amazing both at work and outside of work. So wonderful. So let's see. I think that's it from our audience. I don't think that we have any more questions unless anyone wants to slip one in there. Okay, but no, this is great. Oh gosh, I think I just saw one pop up, but it went away really quickly. Nancy, so while we're waiting to see if that one resurfaces,
Yeah.
I asked Janet earlier if she had any books to recommend. That
My,
I was telling her, like, so I'm a recovering librarian, and whenever I get stressed out, that's what I do. I'm like, how can I research this? So if you had a book that you could give somebody to say, this is what you can take to apply to your life right now.
yeah. So the first one I have many, and of course I'd have to go to my Audible to find the exact title of them. So I'll go with the one
Yeah.
that popped into my head. I am a huge, huge, huge Brene Brown fan. And her book, Dare to Lead, is
Okay.
one of it's a culmination of all of her work, but really um, geared toward leaders and how leaders can be strong and vulnerable at the same time, is the way I would describe it. And I was thinking about, when you were kind of summarizing how amazing it is that St. Jude offers these programs. What I love about the resilience, what Rise and Shine, both programs, is that it is acknowledging that we are going to feel more than just strong and focused and giving to our patients and families.
Yeah.
That there is a whole range of emotions that we will have in the process of doing that, with or without COVID. But you put COVID on top of that, and that just screams vulnerability. I don't know what the rules to the game are going to be today. I don't know where, how the swabbing processes are going to be, which elevators to use, which doors to use, all of those little things that we've had to make changes to.
Yeah.
They become the keepers of all of those changes and making sure that everybody's following them. And that can get really, really taxing for
Mhm.
people. And so acknowledging that all of those emotions that equal vulnerability that are not super popular in our culture, right? Because it's not cool and it's not macho and it's not tough, right?
Yeah.
Um, I think that Brené's work around vulnerability couldn't be better timed for where
Mhm.
we are at St. Jude and where we are in the world, frankly. So
Yeah.
that's my big plug for that book.
That's great. That's great. And that makes me think of something really cool you said the other day. You were saying that so all of us have been in this, right? So we see the I can't stay home. Well, we work for a hospital. We have to be there,
Mhm.
at least in some capacity. We have to be present. And you said the other day with the world reopening and people coming back, it is a lot like the freshman class coming in and like you guys don't know how this works. Let me show you how this. You're doing it all wrong. Like you've got to mask up, stay 6 feet away
Yeah,
from me, please. Like talk in this direction. Um, so yeah, no, I thought that was just the
yeah.
perfect analogy.
Yeah, that was
Um,
one of the nurse managers actually coined that one as I was asking, okay, guys, people are coming back in. What's it like? How you holding up?
yeah,
That was the analogy. It's like we're the seniors and we're
yeah,
seasoned and we know how to play the game, even though it's not all written down. And now all these kids are
yeah,
coming back and they hear it, but they're not behaving it yet. And my reminder to them was, "Yep, and y'all were there about 6 weeks ago." So,
right,
right,
yes, very
empathy.
familiar.
Pull that empathy emotion up. Yeah.
No, that's great. That's wonderful. Okay, we've got two more questions. We'll go ahead and do those, and then I think we'll wrap up. We're a little bit over time, so thank you to everybody for hanging out. This has been really fun. Um, I feel like I've got so much that I can take away. Okay, so next question: how do you help ensure that nurses take advantage of these resources instead of the typical like, I'm too busy to do anything else right now? I
So
added
for the
that tone of voice. The tone of voice was not in the question.
It was effective.
Thanks.
I would say for the RISE program, the fact that our leaders are supportive, the fact that our leaders share their own stories of vulnerability. And, I went through this patient event and I wish I had had someone to talk to. We often make rounds through the different units and different clinics, reminding people about the availability of the RISE program. And like Nancy mentioned, really normalizing the experience that this work
Yeah.
can be tough and that having emotions, having experiences isn't a sign of weakness, but reaching out and asking for help is the strength of vulnerability, which I think Nancy put so beautifully. So our leaders are supportive, our RISE responders are, like I said, embedded in those units. And so they can really help normalize the experience. We're proactive in making sure that people have our number. It's
Mhm.
posted in so many places, it's on the computers, we have signs in the bathrooms.
Mhm.
We really want to make sure that people are aware of our presence and that they know it's okay. I think that since it is a confidential program, we don't get
Mhm.
we can't reach out to Sue and say, "Oh, tell everyone how great it was to talk to a RISE responder."
Yeah.
But what we're finding is Sue is going to do that on her own, and Sue is going to have this positive experience, and then tell her coworker the next time something happens. You know what? When I called RISE, I really felt better. Why don't you give them a call? And so I think that that's how we help make sure that nurses know that it's a good thing to engage in, and they understand that.
That's great. That's great. What about you, Nancy?
Yeah, I think with the Shine program, because it was targeted specifically at managers, we
Mhm.
opted to we didn't make it mandatory. We didn't say you have to
Okay.
attend this. And then 100% of them signed up, which I thought was great. Um,
Nice.
and, the second part of the program, we did emotional intelligence on the first part. The second part was about creating the environment for their people who report to them to feel safe, to have the same kind of conversations with their managers. And so we started to talk about what are the kinds of powerful questions that you can ask people to let them know that it's safe to open up. Questions that aren't judgmental, but questions that really invite people to just be honest and real. And so they started practicing with those midway through the program. So different from the RISE program, where the confidentiality is so important, and the marketing has been super effective because people are talking about it, Janet, just so you know. But RISE being different, it's the managers creating the environment for people to feel safe, but then also making those referrals. I mean, a manager can say, "Hey, have you considered calling RISE, right?" And reaching out, and that it's okay to do that.
Yeah. No, that's great. That's so I remember when I first joined St. Jude, there was something, I think it was like a town hall or one of those programs where the whole institution gets together. And my manager was like, "Oh, you should go to town hall." And I was like, "Cool. So like, do I do that during my lunch break? Do you want me to like check it? Do I need to stay an hour late?" And she's like, "No, you just go." And just being so amazed that someone found value in something besides just like me sitting at my computer and typing
Right.
things all day. And I feel like St. Jude is so good at that, at saying, like, we know that there are parts of your job that can be infinitely more effective if we give you the tools and resources and like make you feel part of this community. So it is, yeah, no, both of these programs are fantastic. And I think that St. Jude is so good at making sure that nurses know that all of us know that they value those sorts of things. Um, Okay, so we're gonna close with my favorite question asked during Talent Talks, and that is, what is your favorite memory of your current role at St. Jude?
Oh,
Oh
I
my.
know, it's such a good one.
Nancy,
Favorite.
you want me to go first?
Yeah, you got it? Because I'm still thinking.
Okay. Favorite memory. Um, since I've been in this role with the Resilience Center, I've been able to talk to so many people about, you know, struggles that they've experienced, or challenges, or help give information, help give resources, help give support. I think my favorite memory is, anytime that I'm walking through the hall and someone I don't know, we're a big institution, right? We have a lot of people here.
Yeah.
Someone I don't know stops and says, "You know what? I'm really glad that you mentioned this, or that I know that this resource is available to me. I didn't know that I had access to that. And I'm so glad. And it's been so beneficial to me." And that's my favorite. It gives me goosebumps now when I think about those times that employees, like you said, see that they are a valued person, that it's not just their work, it's not just the care they provide, the research they do, but that they are a valued person and human.
Yeah.
And I am so glad every time someone says, "Wow, I know that I'm cared for by this place that I work at." Oh, I just love it.
Yeah.
That's great. That's wonderful. Nancy, what about you?
Yeah, I have one actually from this week, and it's similar to what Janet is saying, knowing that you get to make a difference, but not always knowing when you make a difference. I
Mhm.
received a text from a director this week, thanking me for working with one of their managers, and how the manager has really sort of, really stepped up and leaned into the role that they're being asked to do. And
Yeah.
these are hard roles. These managers they're very difficult roles, where they have lots of people reporting to them, or just so much that they have to juggle. And so just a random text out of the blue Monday morning, "Thank you for this. It's really made a difference." And that will be my favorite moment any day of the week, when
Mm.
Yeah.
someone unsolicited, or in the hallway, like Janet said, lets you know that something you did mattered.
Yeah. No, that's wonderful. That's so great. I'm so excited for both of you. I just realized I had to stop myself because I was doing like a happy dance for both of you guys. Because no, it is wonderful. Oh, it's my favorite. It's my favorite type of thing. Okay, so thank you guys so much for being our first guinea pigs for our social distancing edition of Talent Talks. Thank you for being very patient with the technology, because we all know that that is fallible and uncontrollable. but I think it went well. So thank you guys so much for taking the time to speak with us today. Thank you, everybody who tuned in, everybody who is seeing this after the fact. If you have any questions, please feel free to reach out. My name is Sarah Strain. I'm a clinical recruiter. Or if you think you might be interested in clinical opportunities, it's wonderful in case you hadn't picked up on that. You can always check out our new positions at stjude.org/join our mission. Thanks so much.
Thank you.
Thanks.